Let's look at preeclampsia, one of the conditions affecting women in pregnancy, especially in the developing world. So, preeclampsia is a pregnancy specific disorder characterized by new onset hypertension and proteinuria or other signs of organ dysfunction after 20 weeks of gestation in a previously normotensive woman. So we have a diagnostic criteria for preeclampsia, which is considered after 20 weeks gestation. Here there is hypertension of a systolic blood pressure of greater than or equal to 140 millimeters of mercury, or diastolic pressure greater than or equal to 90 millimeters of mercury on two occasions at least 4 hours apart, and proteinuria of greater than or equal to 300 milligrams per 24-hour urine, or greater than or equal to 1 plus on dipstick testing, or protein/creatinine ratio of greater than or equal to 0.3, or even without proteinuria, presence of organ dysfunction such as elevated liver enzymes with right upper quadrant pain, low platelets less than 100,000 per microliter, renal insufficiency, that's creatinine greater than 1.1 milligram per deciliter, pulmonary edema, cerebral or visual disturbances such as headache, blurred vision, and seizures. So what's the pathophysiology? Here the pathophysiology is simplified. There is abnormal placenta implantation resulting into poor blood flow, which will further result into placenta ischemia, that's lack of blood supply to the placenta. This will result into release of anti-angiogenic factors and inflammatory mediators, resulting into endothelial dysfunction. This causes vasoconstriction, hypertension, leakage of protein, and organ injury. So what are the risk factors of preeclampsia? First, pregnancy, that's primary gravida. Multiple pregnancy, women carrying twins or triplets. Previous preeclampsia, that's a history of preeclampsia. Chronic hypertension, diabetes mellitus, obesity, molar pregnancy, family history of preeclampsia. So what are the clinical features of preeclampsia? We have hypertension, proteinuria, edema, that's on the face, hands and feet. We have headache, blood vision/photophobia, that's fear for light, epigastric or right upper quadrant pain, decreased urine output. You also have seizures, which indicates progression to eclampsia. So what are the complications? The complications, we have maternal complications and fetal complications. In the maternal complications, we have eclampsia, which is seizures. We have HELP syndrome, that's hemolysis, elevated liver enzymes, and low platelets. We have renal failure, pulmonary edema, DIC, that's disseminated intravascular coagulation. We have cerebral hemorrhage. The fetal complications are intrauterine growth restriction, that's IUGR. We have preterm birth. We have intrauterine death. We have placenta abruption, also known as placenta abruptio. Thanks for listening.